We are live.
James, you're
still there, so we're live.
Well, we was holding court in the hallway.
Yeah.
So
Well, we're
Maybe she was
James holding court in the hallway.
So it's February 3rd, the Senate Appropriations Committee. We're going through the budget adjustment act for appropriate reform. And we have the chair of the House, the esteemed chair of the House Appropriations Committee, to walk us through the good work that the House did on HW 90. So I'll let you give any further introduction that you want to give of yourself.
I'm Robin Scheid from Middlebury and chair of the House Appropriations Committee, and it's wonderful to see you all again. Here we are, budget adjustment, which we had a successful budget adjustment this year, and it passed out of our House on a roll call vote of 133-0. So it was a unanimous vote, which doesn't happen often enough, but it did. So we're very happy to send that over to you. I chatted with Amy from Joint Fiscal, who gave me a list of some things that you all were talking about. So rather than go through like the whole bill, which we don't need to do, I can just highlight some of the things that she'd identified that you were interested in, and happy to answer any questions about anything else that I don't touch on. Does that make sense?
That makes tons of sense.
Okay. So one of the questions was about the money for non-emergency medical transportation funding, and these are the rides that the public transit authorities around the state, they're Medicaid rides, so people who are Medicaid eligible can get rides to their doctor's appointments because they don't have a car or they can't afford it, whatever. So that's what that is. And pardon me?
Do you have the section?
Oh. I can't find that section for you.
And we're looking at the bills introduced.
Yeah.
We don't have the pads yet.
We do have the web.
We do have the.
And we have, okay.
Let's see.
Oh, wait, I think it's on a B1100 E5 section 51.
Oh, I opened it. I
Notice that. So what's happening is that with the closure of various doctor's offices and other things, people are now having to be driven much further to places, not exclusively, but that's one of the things. So what used to maybe be a 20-minute drive one way is now 45 minutes. And so there's the mileage and then there's the time and more people. So that was the public transit associations have been in a deficit in fiscal year 25 of $800,000. That was the federal and state contributions combined, and then a further $500 million deficit the first quarter of 2026. Again, there's global commitment involved in this, so it's not just general fund money. So it's an example of a much needed service that's been underfunded, and so we were able to use some of the extra funding we were able to find to fund that. So that's what that was. The next one was 167,000 general fund for the Bridges to Health program. Oh, this is all in B1100 right now. The next few of these are. This is their transition from UVM to the free and referral clinic, and it's a cost to doing that and getting equipment and things like that. So they are in the process of moving, and that was that request.
Representative Chai, sorry, I was looking at things when you were talking. The money for the Medicaid non-emergency transport would go to AOTs.
It would,
and then they would distribute it, or how do you remember how?
no, it goes to
Directly to the
Diva?
provider?
It goes to DEVA, and then they have a contract with the public transit agencies, and it gets doled out through that public contract, and that public contract, just for information, is out for bid right now.
Right. But yeah, so the idea is it goes to the Vermont Public Transit Association, so it isn't going to one specific, but through. So, and then I mentioned bridges for 167, and then the next one is the 1100 G9. This is an additional 420,000 to the recovery centers, 228,000 is from the Substance Misuse Prevention Fund, and 192 is general fund. So what happened here was that last year, the FY26 budget, we authorized $800,000 to go to the recovery centers based on what the recovery centers said they needed for each specific recovery center. So some might have needed 10,000 and some might have needed 75 or whatever to do the work that they had to do. But they put it all together and said, here's the 800,000. Here's how we like, how we need it.
Yes.
And the department chose to do it a completely different way and just level fund each one for $50,000. And so some ended up with more than they needed, and many ended up with less than they needed. And they'd already made their plans based on what they thought they were going to get. And there was no ability to change the money that had gone toward. So this is the difference. And we, in the budget adjustment, said specifically where they need to go to, which are the recovery centers, and how much.
Senator Norris.
Yes, we discussed this earlier. I just need some clarification. I said Amy was very instrumental in this also. So I know there's 11 throughout the state, but there's one in St. Albans that's not part of the program, but they still receive funding. Correct.
I believe so. So the only ones in here, this is not all the recovery centers. You're correct. These are the only ones who got shortchanged in the way it was done.
Okay.
For the 800,000.
They were the one that got flat, like everybody got the flat.
Right. Everybody got 50,000 and then they got like $1.37 per Medicaid population in whatever. So it was a different methodology.
Thank you.
So that's that one. The next one, B1100J, they did not add the Read Vermont program for 700,000. So you'll recall that we had the revenue forecast on January 16th, and there was a downgrade of $8.1 million. So the administration went back and said, we're going to change some things around from the budget adjustment that we gave you, and we're going to take some more money from here, but then now we want you to spend it in other ways. So this wasn't actually part of their original budget adjustment. And one of the things they wanted to do that they just gave to us suddenly was 700,000 to the Agency of Education for this Read Vermont program. So there was no opportunity to take testimony. The House Education didn't take testimony. We were just asked to put the money in the budget, and that's not really how we operate. So we said, probably a great program, but we need to hear more and hear from House Education. And, that's so that we did not accept that proposal.
Okay. That's helpful.
Which section was that?
1100
It's on
J.
page 20 of the.
And then the next one was a happy news, B1100 R6, the reduction of just over 2 million from the Brattleboro retreat. That's a negotiated reconciliation every year. And they went back with more of a fine-tooth comb. This also happened while we had the budget adjustment. It was originally going to be something like 7-point-something million, and it's now down to 5-point-something million, and it's 2 million and change, a reduction, which brought more money back into the general fund. So we thought that was good. The next one, B1100 T, was adding money back to the food bank. We ended up increasing it by about 500,000. They requested 1.5 million at the public hearing. And we agreed to 500,000, given the way things have been. One of our House members, Representative LaRouche, went and talked to the head of the food bank and got some information about that, and then came back and we made a recommendation with that where they ended up.
Did you do another food thing, or this just the?
That was it.
The 400.
The 400 was in FY26 budget. We added 500, so now it's 900. So the 400 we all approved last year.
But you added 500.
We added
Doesn't
500.
this say they added 1?
It
was 5, you added 4.
Oh, that's, I got that.
Okay.
Yes, I'm reading it too fast.
You're right. The end result is 900.
Yes, yes. And then in section 53, D101 is a fund transfer. You will note that the administration asked us to put in just over $1 million into the criminal justice records check fund, because revenues have failed to meet expectations. And this is an ongoing issue. This is one of the themes that we picked up on if we were doing the whole budget adjustment. When you have a special source of funding identified, and then that funding doesn't live up to expectations, we end up backfilling into general funds anyway for the project for which it's done. So there's a whole larger conversation to be had about special funds and how we use them and whether we should be running funding deficit and all of those things. So we said, okay, it's good fiscal policy to not have a special fund in deficit by $1 million. And we want to know what your plan is to not have this happen again. So that's what the language is in there for.
So this was for the background checks, not the fingerprint checks, correct? Through BCIC, the special fund.
This is not my house.
That's how I remember it was around the back. Check.
Incurring a deficit due to the Department of Public Safety, Vermont Crime Information Center.
Right, so the next question was, we know that they came in here, we know there was a deficit on the criminal records check. However, I think we had a discussion, okay, so now what do we do as far as addressing who gets to raise their fees? We should be subsidizing these programs, obviously. And charging for them, they should be charging appropriately.
Yeah, we didn't go there with that. We said, okay, we'll agree to the governor's proposal to backfill the general fund. But if we do that, we also want to see a plan for sustainability, because this is making sense. So if when we get that plan, then we will see what they come up with.
What section is that? I know you're talking, but I don't.
Transfers, fund transfers, D101.
Just it won't be able to.
Section 53.
But it probably is in here.
And then it looked like there were some just questions about other fund transfers out of DFR. We just accept whatever the governor did. We didn't have any conversation about that.
So sorry to go back to the criminal records check. So you added this to report it back.
Yes, we was report to address sustainability. So there was language in the E section about that.
Like that,
Yeah,
is the Vermonters Feeding Vermonters grant program, the same place we put the money in the fall, when,
Yeah, no, when we did the money for with the e-board.
Yep.
No, that was straight to the food banks to get out to the partners. This Vermonters Feeding Vermonters is has to do with contracts directly with Vermont farmers who will grow a specific quantity and for a specific price. Yeah, that's what that is. And we need to get that out before the growing season starts. Can't start a contract in July. Maybe for kids. Okay, so back to D101, DFR changes, general fund transfers. Those are just recommended by section D101. Oh, section 53, but it's D101. It's just DFR does their thing, as the year goes on, they raise and lower by a little bit. So we just accepted what the governor recommended. We didn't actually really have much conversation about it. And then D102 in section 54, a reversion adding 700,000 back to the general fund. This was done by the administration as the result of the downgrade of $8.1 million. They had to do some more reversions so that the activities in the budget adjustment could be funded. And then in section D103, which is section 55, D103 reserves, the governor had said wanted us to spend $74.9 million now to buy down property taxes, just to buy down property taxes. Yeah. And so the budget adjustment is not the appropriate place to make a commitment like that when we don't have all the budgets in and we don't have a yield bill, et cetera. So what we did was we simply carried it forward But we also didn't want to commit the full 74.9 property taxes, because what if we find out something and we don't need it 74.9? We may, but so we just put in language that was the same kind of carry forward language that we used last year, that it could be used for federal funding, property tax relief, or other things that will help Vermonters. So it's the same language. So it doesn't mean it can't be used for that. It just means it's not now a budget adjustment because we don't have enough information.
So it's just kind of keeping it where it was under the language
Yeah.
that we passed last.
Right. Right. And it'll be addressed in the big bill.
The whole 74.9.
We didn't take anything out of that. In section 77, which is B 312 public health, the increase was not just to Vermont Cares, it was to 3 HIV/AIDS organizations. We have done this. We've had the same amount we've given to these organizations for at least the last 8 years and maybe 10 years with no increase whatsoever. 2 organizations that they used to fund closed. And so the other 3 left are picking up the extra work and have inflationary costs and things like that. So we put 45,000, and you'll see in the budget itself, it's specific. Vermont Cares gets like there's 15 and 25 and 5 or something like that. Is that right? 25, 15 and 5. Okay. So that's what that was. And then the next 2, sections 78 and 79, have to do with Section 8 housing. And this is new for all of us. We propose using 5 million of the 50 million from e-board that we'd set aside for the e-board for federal funding kind of losses that would be pretty serious to Vermonters. So that's where we use the SNAP money. We had a special e-board meeting last year when we had the government shut down, and we did 6.5 million for funding equivalent of SNAP for 15 days plus the money that we pay. So they were still 50 minus 6.8 or whatever left in that money. We almost had a second e-board meeting to cover Section 8 housing. And then as we dug into it a little bit more, realized that from a timing standpoint, we didn't have to meet in December, but we could meet when the General Assembly was back in session. So we didn't need an e-board meeting. This is also something, the vouchers for Section 8 housing, which is subsidized housing for very low income people who still have to pay 30% of their income to rent. And then the rest of it is paid by the federal government directly to the landlord. So we're not used to seeing this because it doesn't come from the state. So all of a sudden we had to have our joint fiscal office and legislative council get up to speed on what all of this meant. And it's a pretty complicated program. And to learn more about the public housing authorities. But the proposal is to use 5 million to support the public housing authorities and who would apply for grant funding, like we've done with provider stabilization grants. They would apply and then be approved. We, in our budget adjustment, had the agency of administration overseeing that, because there has been a relationship with the AOA and the public housing authorities in the past, apparently. And so that seemed like the appropriate place to put it. I know that the letter that's come may have a different proposal, but at any rate, that was where we put it to start with. The point was to have it here. And then we also put in guidelines to ensure that the money would be used in such a way that it wouldn't hurt future vouchers and renters or the public housing authorities, because there are very strict guidelines on how any money can and can't be used for the public housing authority. So we can't directly pay rent, for example, that would hurt any future vouchers.
Who would you recommend we have in if we wanted to learn more about that?
James.
Probably James and
James Duffy from
Cameron
and
Wood
Cameron Wood.
to talk about the.
Yeah, because
Language.
Cameron did the language and James has become our local expert. And what we also wanted to be sure was that there were no bad unintended consequences, and that by doing this, we're actually maintaining future vouchers at a level that's current vouchers, because if we don't, they give you the feds give you money based on the number of vouchers you did the past year, and if they go down, we end up in a downward spiral every year. We don't want to have that happen. So we're trying to prevent homelessness by doing this. That's kind of the bottom line. Okay. And then, section 81, B 325. The governor's proposal in the budget adjustment was to add $2 million for more shelters. And at the same time, it was reducing the funds available for community partners related to HOP grants, the Housing Opportunity Grants, which again helps prevent homelessness or treats people homelessness. So on the recommendation of our Human Services Committee, we reduced we kept the 2 million. It's in the same area, so you don't see a lot. But what we did was we kept 678,000 for additional shelter expansion, and then we applied the remaining 1.3 to restore financial assistance to the for the HOP to prevent people from falling into unsheltered homelessness or and help them move into permanent housing. So that's just a shift of some funding there on a one-time basis.
You have did you get an analysis or printout of the housing assistance funding generally and where it's coming from? I mean, I see here it's from our action resolves from 2025. I see the $5 million there in that section. And then this money, it's being transferred.
It's all staying within OEO.
It's all.
That's why it doesn't look like it's very
Okay.
different. It's just rearranging the money that's in OEO.
Got it. Okay, thank you. That's
Yeah. And then the last one we had on the sheet that I got from Amy was some language that we put in regarding payment reform. This is with Dale and payment reform for the designated and specialized agencies. The issue is, and everybody agrees that there should be payment reform, and the DAs are all for it. It's the process that's happening right now is creating serious financial problems for the DAs if it continues the way it is, and they wouldn't actually get paid for 17 months, and not too many nonprofit organizations can go 17 months without getting reimbursed for the work that they do. So this is the conflict-free case management is the other side of it. That started October 1st, and that's in process, and that's going. And then this is the other piece of it, and it just we actually convened a meeting with all the players from the DAs and Dale and listened to them have a conversation. And we had some other experts in the room. And it was very clear that we couldn't come up with a solution and fix this in 2 days when we had to get the budget adjustment out. So what we said was, we're going to put this in as language and we need to have a progress report back to all of us by April 15th and how we can handle this. So there's not a money thing, but it's a serious issue that needs to be addressed. So those were the things on the list.
Your committee took testimony on the using the pilot funds for the reappraisal programs.
We did take some testimony. We had Chris Roop come in. There's actually a lovely spreadsheet that he put together. The governor is proposing the exact same thing for FY27 to use the 3.41 million of pilot money for the payments to municipalities for their parcel payments, appraisals and listings. So using pilot funds for that. The governor's proposing that to start in FY27. We said, great idea. Let's start it in FY26. We can use 3 million of that for the pension issue that we have to address because the ADA came in at a different amount. And then we used a little bit of the extra for some of these other things that you saw in here. So it's already sort of been created by the governor. We're just starting it a year early. And the spreadsheet that Chris presented to us shows that even at the end of 2027, after this has happened for 2 years and 100% of the pilot is paid out the way it's supposed to be paid out, there's over $11 million still left in the balance of the pilot fund. So it's got plenty of money in it.
We had been scheduled to come in and do it. I think we talked about having Chris come in and get
Yeah.
this.
Yeah, but we found it
presentation on
extremely
pilot
helpful.
fund. Yeah,
Yeah, and it was reassuring, let me put it that way, to
Yeah.
see that information.
okay. I think you did touch on the things that I knew about or, any other questions for the House Appropriations Chair? Or just the phrases or accolades?
All of the
So yeah, I think, I don't know if your committee should consider Lions wants to take up that designated.
We'll be looking at that.
I think that'll be
I've already
something.
started looking at it.
Yeah, there've definitely been a bunch of people that have, no one's been involved in that. He was part of the meeting that when we had the initial meeting, when we realized it can't be fixed in budget adjustments. So let's get, so hopefully
Well, and
the
if it-
sides are all meeting
You
now.
know, if it is, it has to happen with the full policy discussion.
Right, well, that's why we said April 15th,
Yeah.
or come back and tell us how you're gonna fix this thing. So there'll be plenty of time for you to get involved with that.
I was glad to see that you did the money for the elderly and disabled rides. That's something that we had a joint meeting, transportation and it's a critical issue. We could use more money, but
Yeah,
that's going to help.
Yeah.
Well, that's, I don't have anything else.
great. Thank you all.
Anybody
Good
else?
luck.
All right, thank you.
Tried to make it easy for you.
You did. We'll be in touch.
Thank you.
Then we have JFO come talk to us about some details. Okay. Just.
Never.
We're gonna have, we're having that bill is passed, printed out, so there's some little changes from that as introduced we have here. So it should be writing shortly. And we have a spreadsheet that's called the Emily spreadsheet. I don't know if you want us to pass that out.
Yeah, you should. And I can probably share it on the website.
It's just one page. Right?
Yeah, around back.
Should be a lot here.
Oh, yeah, there's
Just
a
one
lot.
page.
I've got
Just one page.
Just one page, not that.
I need one.
It's no minutes.
Mistakes.
Would be one of them.
There's many. Sometimes, like Nolan shows up, he wants one,
Can you send
Chris
another one?
wants one, that's the whole thing.
Senator Bruce, can you send that? back?
Yeah.
If anybody else wants one, they can do there. No, you can.
Yeah.
Hurry up. You're doing the check boxes this year, so if you have those boxes we've checked and they'll be like an automatic strike through.
Yeah, we got real fancy.
Yeah.
Doing this box this year. Yeah.
Did you want to introduce yourself for the record and then we'll give us the overview?
Sure.
It's been several months since we've looked at one of these spreadsheets.
Yes, so for the record, Emily Burns, the joint fiscal office, here to talk about the FY 2026 Budget Adjustment Act. I'm going to share the spreadsheet that you have in front of you. On the screen. Those were at home. So this spreadsheet. Yeah, it should look familiar, but also it's been a while since we've gone through this, and this is the budget adjustment as opposed to the budget, so it'll look different, a little bit different in the budget, but the main gist of this spreadsheet has at the top, so this sort of gray chunks, this is the budget as passed. So there's nothing to change on this side of things. And this is the appropriations as passed. So line 2 is where you got baseline appropriations, and right, the adjustment is changing where you ended last year. You've got the Pay Act and other bills, one-time appropriations, the transfers. I'll just flag, everybody says, what was the 190 million? And that's 70+ million to debt service and 77 million to the education fund, and then all of the other little transfers that happen. But the majority of that are those two big ones. The contingent appropriations and transfers. So that is primarily the $50 million that was appropriated to the emergency board for the backfill of federal funds if needed, another $8 million to the agency of digital services, and then the $61 million is the amount that was transferred to the reserves. Of that 61 million, 60 of that are the two $30 million reserves that were done at year end for federal fund uncertainty and other needs as identified in the future. So then structurally, and the next in the sort of blue and orange box, we've got GovRec updated because there was an update to the 26 budget after the emergency board adopted the revenue downgrade in January. So the governor presented a balanced budget adjustment to the House Appropriations Committee in December and then had to change it slightly. So this is updated to reflect those changes. The Rep Shy touched on some of them. The next column, that's the House. Most of those, the House accepted most of the changes that the governor proposed. And then in a difference from the governor, see places where they were different. And then the Senate column you can see is blank. You guys haven't made any choices officially on whether or not you agree with what the governor has put forward or what the House put forward. So as you go through and make decisions, fill that in from there. I don't know if you want me to go through individual lines specifically at this point, or I want to keep orienting to the spreadsheet.
Yeah, show from the other page.
And then, so there are a lot of changes in this budget adjustment, and these are, I should also qualify, these are just the general fund changes. So that big spreadsheet that Commissioner Gresham gave you at the outset, that has changes for the general fund, the transportation fund, global commitment funds, special funds. So in terms of reviewing the Budget Adjustment Act, going through that spreadsheet to make sure you also agree with or disagree with any of those global commitment changes or other things will be important. So then we get down to line 85. This is where, or line 84 is the total of all of the changes to the base budget. And then starting on line 85 is where we get to the one-time appropriation changes. There's a little bit more going on in one-times as there usually are budget adjustments. So we have some new
Is there
sections.
Is there a reason sometimes parenthetical numbers are read and sometimes they're not? Is that just, that's not, there's no reason behind that, just like they didn't get
It's like if you
formatting.
accounting or number
Yeah.
in the formatting.
Okay, I didn't know if there was some other reason for them not to be read.
No, we can go, I should go back through and double check those.
But the end story is the House is $110,000 less than the governor's
Yes, on the,
on line 102. Or like 3.34 million on line 84.
yes. Yeah. Right, in terms of changes, yeah.
Right.
So and then, so you've got the one-time appropriations, then you have the few transfer changes. The very small changes related to the criminal history records check fund that Representative Shy mentioned. So transferring some money there to deal with the deficit. And then there was this transfer to the pilot special fund from the general fund and the transportation fund. That wasn't funded, so that transfer is not happening in the House version. That gets you down to a total of $2.8 billion of general funds appropriated in the budget adjustment by the House. The governor also had 2.811 in his recommendation. The green box at the bottom, this is the revenue picture. So from line 111 through 115, this is the as passed revenue. So none of this will change. This is what you assumed to pass the budget. And then below that are the things that have changed since
Can I ask you, Emily, on 108, 109, why is the difference, say it's 180,000, but it looks like it's
It's the
2,000.
111 or the 110,000 from line 102 plus the 70,000 on 106. It's the 180.
So you don't do the math from the governor's column to the house's column for the change.
Not, yeah, the change column, I need to look at what that formula is, but
Isn't that normally how it works? Like you're just taking the house, subtract from the Senate, so
Yeah.
that's not point.
I think it's missing, if I were to guess, I think it's missing a row. So I'll check it. I'll get you a better one. I can shoot you a note on it. But so then you go to the bottom, line 117, that's the updated revenue forecast. Adopted by the emergency board. And it's important, this is a little tricky because there was one adopted in July, and then there was one adopted in January. The difference between January to January is what you need to look at, and that difference was $80 million. The
$80 million. Which one?
right, so you talk a lot about the revenue forecast. The downgrade that happened in January was compared to July. You didn't build the budget compared to July. You built the budget compared to January. So from the budget building perspective, you take into account both changes to the revenue forecast for a net change of the $80 million. There are also some additional reversions. Representative Shai referred to those. Those are the DFR changes, mostly. And then the increased direct application, the increased direct applications are the DFR changes. The additional reversions are reversions identified by finance and management and adopted for their authority to revert unexpended appropriations from prior years. So, and after all of that, those net appropriation changes less the net changes in the revenue leaves $74.91 million on the bottom line, as the governor proposed, as Representative Shai alluded to. The budget adjustment indicates that $75 million shall remain on the bottom line and be carried forward into FY 2027 to be used for property tax relief, federal funding needs for other items identified by the General Assembly.
Okay, that's helpful. And if a comment, okay, so that is, and then the notes column, if it's red, it's something the House did,
It's the House, yep,
and it'll be green if we get.
correct.
I approve of the color.
Thank
Yeah.
you. It was hard to
Is that a
find.
motion?
No, I think it should stay house red.
Yeah,
I think it-
yeah, I agree.
The trick is the green sometimes it's not
Harder.
dark enough and it's hard to read.
Corresponds to our road.
You can work on this.
Yeah.
Is there anything else, Emily, you think you want?
I don't think there's
Highlight?
anything else in particular on this spreadsheet to highlight. I think Representative Shai walked through a lot of the details. The differences from GovRec. I think when you're ready to do markup in terms of going through each of these lines, and figuring out whether or not they're things you agree with or disagree with, or if there are easy ones you want to look at and explain. Oh, one, actually, I'll flag 2 lines, just get on the record and be clear on them. I realized I closed this. And
Yeah.
that meant to Zoom went away. My bad.
Yeah, it would be good to, we'll compare it to the worksheet. This is the spreadsheet, the other one is the worksheet.
Yeah.
This.
I do have a
Yeah.
question.
Yeah.
Yes, I agree.
So Emily, you remember Senator Sears and Justice Reinvestment 2?
Mhm.
I'm trying to remember. I remember that Justice Reinvestment 2 reinvested savings. And I thought it was how many beds we stopped needing out of state. And then we could count that as savings in the general fund. But I'm wondering if, I'm looking here at the increase of 30 beds.
What line is that?
It is 79.
Yeah.
It just got me thinking about that. I don't know what you would call it. It was an initiative that Senator Sears spearheaded to try to, number one, bring people back into state. Number two, to save money. And number three, to put a fence around that money so that it was used to invest in programs for justice involved youth and other people. So I'm wondering, obviously, I can't remember the details. I'm wondering if you could just look into that and let us know. Obviously, when he died, a lot of the things that he had been keeping in the air dropped. And I would just like to know where we stand with that initiative.
We can look into that. I also don't remember the details.
Yeah.
Yeah, I can't remember if it was just his work or if we had put it in statute that it had to be.
I don't think it was in the
Said stuff.
that. Well, do you remember, Rich?
The way Sears talked about it seemed like it was,
like,
you couldn't touch it except for the
Lawyer.
investment.
Well,
Yeah.
he had worked out this whole process with, CSG.
was it
And the
grant?
Council of State Government, and I pretty clear it was written down someplace, but I can't remember where. But there was a report that came back from CSG that built us.
So in joint justice oversight, we've had CSG a few times, but I don't know if we've recently talked about that program.
But it was,
Yeah,
it was kind of meshed with an initiative to decrease the number of out-of-state
definitely.
prisoners.
Yes.
Right. With.
Anyway, so we're unfortunately moving in the other direction.
I'll bet you somebody goes back through the Judiciary Committee meetings.
Mhm.
Yep.
We'll find out. Yeah.
Okay.
Okay.
So two lines, just like looking closely at this that may not raise questions, but that you make fun of. So on line 28, there's a line called all AHS. For the net impact of the ADS SLA transfer to the departments. So recall in the AHS budget, in the 26 base budget, put a whole bunch of money into the secretary's office to cover the Agency of Digital Services, service level agreements. When, once they get to budget adjustment, they have a better idea of which departments are actually going to incur those costs. And then they make a net neutral transaction to move the costs into the appropriate, departments. Rather than carry that whole net neutral thing, this is just a line that says it's a zero impact. We did, double check the math, it's zero impact on the agency, but this is just to reflect like what that is. So it says it's zero on here, even though because it's to the budget, the zero,
But it's moving around.
but it's moving around in all of AHS, but we didn't need to add an extra 7 lines to show that net zero thing. So that's just what that is.
But if we wanted to see all the transfer, we could.
Yeah.
Part of the SLA thing.
Yep.
Change.
We do that. And then the last one I would point out is on the back, in the one-time section related to the Section 8 housing. So in the language, it shows up in B1100-01, Part B, Subpart 2. That was a contingent, that $50 million appropriation was contingent. And rather than change that appropriation and then reappropriate the money for Section 8 housing, it just redirects an appropriation that already exists and says to the agency administration, you have this pot of money, use $5 million of that pot of money to do this. The spreadsheet itself shows this as zero because it's not changing the net appropriations at all. It's utilizing existing appropriation, but this is just how we characterized it to, make sure you make the decision on it accordingly.
So is
Yes.
that in the language part of it?
Okay, yeah.
Second,
Yes.
so going back to 54.
Yeah.
Well, was that, well, probably all along this, was that the portion where ADS was backloading and we decided to front load some of those money so that we won't have to deal with all that? In the budget adjustment act,
The
the AHS,
all AHS, no,
Yeah,
I think
the-
are you thinking of the $15 million that we put into the ADS budget last year. Yeah, that was just a straight general fund transfer to their special fund to try to deal with the structural deficit.
But we also tried to change the timing of their SLAs, we like front loaded it, right? So there would be less.
Yes, there are some transactions. Yeah, I think that. I want to speak out of it, correct? There are some charges, or so it wasn't the SLA charges, but sort of their core enterprise services, if you will. So things like Microsoft licenses, that sort of things, used to be billed in arrears. It's no longer billed in arrears, it's billed real time in the actual year that they incur the cost. The SLA is still a look back charge to departments. So, and that's partly why AHS appropriates a lump sum to the secretary's office, and then once they get those actual bills and they know which departments to charge it back to, they move the money around. I think. Yeah, hopefully these all look familiar.
Yeah.
Taking testimony. Everything.
Okay. Any other questions for Emily? Okay, you're free to go. All right.
My goal, I'm sorry, I know.
Anything else in that chair?
Great.
I think I'm understanding this, but I just want to make sure, so. Lines 53 and 56, TANF funding realignment, these match, just that there's some moving from one place to another, from one part of DCF. to another.
Yes, yeah, that can funny for life. Yeah, they were moving money between.
Okay, thank you.
That's the one.
Yeah, it shows up
Yeah.
on line 56 and line 53. Yeah, the net.
Yep.
Thank you.
And-
We will cherish the spreadsheet for the days.
Until I bring you a new one, right?
Yeah.
To change it.
Until you change it, exactly.
Improved.
It'd be improved when you finish.
Okay. We are now gonna go through the language of the civil as passed. Looks like Grady got the end on some actual copy of this as passed.
I see.
Okay. Thank you, Grady Nixon, JFO.
So yeah, the as passed version of the budget adjustment hasn't been posted online yet. So this may have one or two, edits from granting operations, but this is the bill as it was passed by the House. And I think most of what I'll go through is just a repeat of what Chair Shai went through with the committee earlier in the hour. I'll start on page 27. So this is section 51 of the budget adjustment, making changes to section B1100 of Act 27. On page 27, you'll see in that sub 4, this is where the House added 3 million general fund to reconcile the ADEC. So that's where that money is being added. Then on page 29, you'll see in sub 5, this is the general fund and federal fund component of the non-emergency medical transit. So you'll see an appropriation later on where the global commitment appropriation is being made. This is the appropriation to AHS, and then later on that global commitment appropriation is made to DIVA.
Great, and not on this. And Emily, before I forget, I just want to ask you, did they take out that payment that transportation had to make back to the pilot fund? Does it show up on here or for some reason it doesn't show up as the way they did?
It doesn't, the general fund piece is out of here. It's on, there was a little small general fund component, like $67,000, and then there was the AOP piece. The transportation fund piece doesn't show up on here.
Doesn't or does?
It does not. The general fund share does, and
It's just that $16,000 is not going to the pilot fund.
it's not going, 60,000 of general fund is not going to the pilot fund, and the 290 something, I think, E fund money isn't going to the pilot fund. It's one of those, like, because in the governor's recommend, there was language that said transfer transportation money to the pilot fund, but because that's not happening, there's no language about it now. So it's
Is it and only one of those funds? Or
just the general fund one,
where is it?
line 106.
That's how that's.
I think it has a note about the fund balance.
Yeah, 292.
And then you reference the other.
Yeah.
Okay. Okay, sorry, Reggie.
Also on page 29, you'll see the bridges to health appropriation, and then 228,000 substance misuse prevention special fund and 192,000 general fund for distribution to recovery centers. And then you'll see how that appropriation is split up amongst those recovery centers. On page 32, this is in sub 7, where you'll see that DEVA global commitment appropriation. So again, the general fund and federal fund go to AHS, and then your global commitment bit for non-emergency transit goes to DEVA.
You're highlighting only changes in the house.
Correct. Also on page 32, you'll see that change the House made on the last 2 lines of that page, just bumping the appropriation for a grant to Vermont Food Bank for Vermonters feeding Vermonters from 500,000 to 900,000. And then skipping ahead to page 35. This is
That's not. Is that that's not the cash crop, that's not the one with the.
This is not crop cash or crop cash plus. This is Vermonters feeding Vermonters. So this is directing funds to Vermont farmers.
And the farmers should get it to the food bank and then it's distributed like all the other.
Right.
That's.
On page 35, this is the fund transfer section. So this is section 53, making changes to Act 27, section D101. You'll see the language that the House added beginning on line 7. This is intent language surrounding that transfer to the Criminal History Records Check Fund. So GovRec had that money there to stabilize the fund due to deficit mitigation resulting from salary and benefit costs. This intent language just establishes that report back that Chair Shaw mentioned earlier.
That's where the like.
On page 37, the very last line of page 37, this is the reversion section, section 54, amending section 102, Act 27. You'll see the last line is where the House took the governor recommend AOE license payment management reversion of 700,000, just highlighting that because it came in that revised BAA. So this was not in the original BAA, and the House accepted the recommended reversion, but did not make a $700,000 appropriation that was also in that updated BAA. On page 38, you'll see in that sub D language pertaining to the reserve and unreserved of that 74.9 million fiscal year and balance. So this language and number came over in the GovRec. The House added language to it, specifying that the funds could also be used for addressing federal fund shortfalls or any other uses determined to be in the best interest of the public in the subsequent fiscal year. On page 41.
And who has authority on the decision making progress of the process?
The General Assembly.
The General Assembly, and in their absence is
This money is essentially keeping it so it can move from FY26 to FY27, but that 74.9 million would be addressed in the FY27 budget itself.
Thank you.
Or not. I guess it would be, even if it wasn't addressed, it would just fall to the bottom.
Whatever would happen to it would still be addressed, either by not addressing or addressing it in the FY27 budget. On page 41, this language relates to, it begins on page 40. This is the child care contribution reserve language that is proposed to be added to statute. This was largely consensus language that was in the governor recommend. The House made a small tweak to it. I believe the committee will be hearing more about this later on in the week, so I won't get into the weeds on it. The House just added one small line to that in sub C on page 41, clarifying that after those funds are reserved, they must then also be transferred to Child Care Contribution Fund. And the mechanism here is essentially protecting an estimated amount of fourth quarter receipts so that the general fund can be closed, and then those fourth quarter receipts can be transferred from the general fund to the Child Care Contribution Fund once receipts are actually known.
So we'll have a tax in to talk about this.
I believe tax and joint fiscal are going to have a combined presentation later on in the week.
I heard it was gonna be a public show.
So,
Yes, I think Carrot Palm is actually flying it, so that's props to.
Senator Watson.
Oh, no,
Oh, I tell you.
no. It's just excited there. That's exciting.
And then we can skip all the way to page 52. This is section 77. So there are some interim pages here that Chair Shai didn't mention. You'll see as you flip through the bill, a lot of language that was added by the House relating to the repeal of the Office of Legislative Operations. So there's about 11 pages in the bill that are just statutory cleanup, clarifying that the duties of the Office of Legislative Operations are now being split between the Joint Fiscal Office and Legislative Council. And so any statutory reference to the Office of Legislative Operations was removed from statute. Section 77 on page 52, this is where you'll see the addition of $45,000 that the House made to provide grants from the general fund for HIV and harm reduction services. And then you'll see that split amount, and just flagging that this is the only section that is different in the as passed version from the as introduced. So
The only change to me.
this was the only amendment on the floor. Yeah.
That was law.
So the as introduced language, it had that entire sum of 45,000 going to Vermont Cares, and it was found out after the bill was introduced that money should be split up between the three organizations. So rather than 185,000, it's 165,000 for Vermont Cares, 115,000 to the AIDS Project of Southern Vermont, and 60,000 to the HIV HCV Resource Center.
And maybe I should have maybe been listening more when Senator Shai said this, but why the need for the change in the VA? You remember?
I would have to get back to you on that.
You know,
They distribute it to the three that are.
but why did the governor change? Why did he add the 45,000? Yeah, so the
House added the 45,000. This was not.
Oh, that was just an amendment. Do we know why?
I would have to get back to you.
Okay. Okay, great. Okay.
On page 53 in section 78. So this is what Emily was discussing, where on your big sheet, this shows up as a neutral change to B1101. But you'll see an amendment to B1101 sub B sub 2, 50 million for addressing federal fund shortfalls. In lines 7 through 10, language was added clarifying that the General Assembly may also designate those funds for purposes related to federal funding changes. And then carry forward and reverting language, just clarifying that whatever remains of that $50 million appropriation shall carry forward in future years unless the General Assembly reverts those funds.
But is that, you're saying the House added that last sentence to 2?
Yes.
Okay,
So they're just, when we talk about the $50 million, the E-board didn't spend all that. You're just talking about bringing it back up to $50 million.
No, so the e-board action was roughly 6.4 million dollars. And then you'll see in section 79, language that directs a further 5 million of those funds for section 8. This language here is just making what happens vis-a-vis that 5 million for section 8 and allowable use of that 50 million. So it's not changing the total amount there at all. It's just allowing for $5 million to be used for these purposes.
So there's roughly over $11 million gone from the original 50 million. My question is that something that is automatically gets reimbursed? Can you do that or bring it back up to that 50 million?
No, there's no reimbursement mechanism for it. It's essentially that appropriation was a pot of money for dealing with various shortfalls. And the e-board used a little over 6 of it, and then in section 79, it would be using a further 5.
So on that, the 39 million that's left is left for the governor's recommend, or it's just left to do it with whatever.
Right, it just continues to exist as that appropriation unchanged, and then that language specifies in lines 9 and 10 that the funds carry forward from each fiscal year. So otherwise, those funds may be reverted, but this explicitly states that the funds stay in that appropriation for that purpose unless the General Assembly reverts them.
Or the e-board if we're not in session.
Pardon?
Or the e-board if we're not in session.
This explicitly states that the funds carry forward unless the General Assembly reverts them. So the General Assembly would have to revert.
But it's always the e-board. I mean, I guess the legislature can do anything they want, but if with the legislative assembly not in session, you need the e-board to appropriate it.
Right. So the original language gave an appropriation to the Agency of Administration for e-board transfer. Lines 7 and 8 state that the General Assembly may also designate those funds. And then lines 9 and 10 say carry forward unless reverted by the General Assembly.
Because before, if they hadn't added that, they would have had to call the e-board to make a change.
Exactly. So section 79 on pages 53 and 54, again, that's where that 5 million for section 8 is being appropriated or utilized. Section 80, this is notwithstanding language for the pilot fund. So Rep. Shy mentioned that grand list litigation assistance, that in the 27 GovRec was recommended to be a pilot. This is language relating to that change, stating that that appropriation shall be made from the pilot fund in beginning of FY 26. Section 81. So this is the hot money that Rep. Shy was discussing. So you'll see of the general fund appropriation in section B 325 of this act, 1.3 million shall be used by DCF OEO for distribution to community partners providing services to prevent and address homelessness. And then on page 56, you'll see the 13 community partners that are outlined and funds that are being directed to them. Section 83 on page 57. This is that DA and SSA placeholder language that Rep. Shy was discussing. So this is where you'll see that April 15th report back from the department.
So we're going to want to have DCF, but we have a later discussion on this. We don't already tests that are very.
I apologize for missing Representative Shy's description of this. I have heard it called placeholder language. Maybe Senator Lyons can also enlighten me a little about this. I'm just wondering, this calls for report after consultation. And I understand it's placeholder, but was thinking from the House that we would need other language besides this?
So you're talking about section 80.
Are you in section 83?
Yes.
Oh, okay. I was still back in the other one.
Yes.
But yeah, no, our committee will be working to have a language change here.
Okay.
This is temporary because there needs to be some kind of funding that will take our DAs over that 17-month period, and how to do it is the difference of opinion. I think that's right.
Yeah. So in other words, the House isn't looking to advance this language. I
I think they're looking at us to make
Yeah, they seem to be open
Yeah,
to
they.
further work on.
Yeah.
Okay, great, thank you.
Full payment, phones, been fair.
Very. Understanding those things.
On page 58, sections 84 and 85 deal with rural community hospital, non-critical access hospitals that are participating in the rural community hospital demonstration being exempt from the provisions of statute limiting prescription drug prices. So section 84 adds that to statute, and section 85 outlines that such hospitals may submit claims to a health insurer for reimbursement of prescription drugs that exceed the limits set forth in that section of statute.
So why do you need to both exempt them and then put in language saying that they could increase, they can go over the limit, like by exempting it, then I guess they can charge over the maximum.
I wouldn't speak to this specifically. It might be good to have Jen Cardemon to explain the mechanics of the language.
One is directly related to a specific hospital and others look more general.
For all the other.
Yeah, so that would be an interesting policy discussion.
Right, well, this is something else your committee can look at and advise us.
Yeah.
You got a lot of work to do.
I know. We never do. This one, even help us fill it out.
And then the fee allows the care board to make further changes. Correct.
Yes.
Basically.
And that is it for House language changes. There might be a comma change here there, but those are the significant changes.
So section 86.
Section 86 is standard annual carry forward language.
It's the same language every year that we add to the. Yeah, I mean, why wouldn't, if we add it every year, why don't we just put it into the budget? Yeah, or you can't do it.
This is for the budget adjustment itself. So any money changes in the budget adjustment. So the budget has the language is here for, general closeout.
Well, couldn't you put this language in the budget? Like it doesn't have any specific numbers. The only thing different would be the date, but you could put the date in that budget.
That's very valid. I don't
know why, and I also wondered why we would give approval to the Secretary of Administration to carry forward. Like if we want everything to be reverted, this kind of says they don't have to, they can carry it. I'll ask Gresham.
It would be a good question for Commissioner Gresham.
Okay, any effective date? Change. Makes sense. Okay. Any questions for? It's on the key on the screen, on the top of the screen. The camera.
Oh,
right here.
There it is.
The different view,
Different view.
changing it up.
Yeah.
You like?
I like it.
I've never seen that one before.
I like it. It's the non official. Don't tell IT that we're using.
Nothing wrong.
I like
The secret.
that.
And especially if you're sitting right there. You
Can do both.
Yeah. You better.
Okay, thank you, Grady. Thanks. So that is info we're getting from JFO. We now have 790. The Pro Tem has a potential addition. I do. Really quickly. So the goal is that hopefully by Friday, I might, or talking to some people about maybe another addition. We will talk about this, and then so by Friday, I'm hoping that we have to fill, basically, we know what we're gonna look at if we can. Depends also on some of this advice we're getting from health and welfare. We might have to push it off the next week. But if we could vote it out, like a straw vote on Friday, as we vote it out on Tuesday, that would be
good, but I know Sarah Lyons committee has a lot of other stuff going on, fixing our whole healthcare system, so.
Yeah, we won't be able to look at the BAA as quickly as I thought we might. We're kind of, everyone's busy, joint fiscal included. So we'll try to have something by Friday. We'll be looking at it Friday and making some decisions, so
Okay, well, we
see what
can
we can do.
check in later in the week and see if we can make the Tuesday day goal or not. Okay, so Senator Briggs, what do you got there?
So this is a proposed addition to, we just went over page 53 of H790, and this is added to that paragraph. It's the 50 million. And you'll see highlighted there. So the 50 million needs to be transferred by the emergency board when we're not in session. In the event of a reduction in federal funds, this adds another eventuality, or in the event the state or its municipalities incur public safety costs necessitated by the deployment of federal agents within the state. Now, this originated with discussions with Burlington and Winooski, places where we might reasonably expect federal agents to show up, given what we've seen around the country. In the event that that turns out to be the case and you have counter protests of a certain scale, we would need, as we've seen in Portland and Minnesota and other places, we would need a greatly increased police presence to make sure that nothing spirals out of control. So this allows, of the 50 million, it allows the emergency board, if we're not in session, to make a considered decision whether or not municipalities have incurred reimbursable costs for protecting public safety in this specific eventuality. And again, if we are in session, the presumption is that we would be able to do something more direct. But this is to protect us in the event that we are not here and over the summer we see increased presence of federal agents and the, now predictable response to that from citizens. So I'm happy to answer questions about it, but it doesn't say that money must be spent, and it doesn't appropriate it. It leaves it to the emergency board to make that decision.
Makes sense. Any questions? For now, you
I gotta,
can
prepare to take this and
think about.
Yeah, I put it on the table now with the idea that we'll have several sessions to pick things first.
This may be still the question, but the vision there is that it might be on a reimbursement basis.
Yes. And they would have to show those costs. I'll be saying. Yep.
Well, there's 39 million or more or less left in that fund.
Right.
But there's no cap on how much they could ask for if they.
And it does say in the event of the state or its municipalities. So this could be used theoretically by the administration to say DBS has incurred $2 million additional costs, and we want to put right that.
Yep.
And it could be public safety, it could be correction.
Would we want to spend 39 million here?
Well, I very much the emergency board would spend, we've spent very sparingly from this so far. I imagine it would still be the case. I also imagine that there wouldn't be more than a couple of municipalities who incur these costs.
There must be a threshold.
Sure.
What's happening in my town?
Okay, well, yeah, we can think about if there's any other wording or questions we have on that. Okay, anything else? Good, well, we succeeded in doing our work efficiently.